Over at the Drudge Report, USA Today is reporting the international telecommunications company Verizon has been tasked with helping the government fix the federal health exchange. USA Today has learned, as an informed source in the telecommunications. This is something that has to be secret and leaked to the media? Why can't the administration say we're bringing in Verizon? Oh, boy. An informed source in the telecommunications industry said Verizon's Enterprise Solutions Division has been asked by the Department of Health and Human Services to improve the performance of the healthcare.gov site. HHS office said Sunday the department would reach outside its government contractors to civilian companies that might be able to solve healthcare.gov's problems more quickly. Isn't this interesting? The private sector has to save Obamacare. The private sector should say no. The problem is all these businesses are regulated by the federal government, some more than others, but Verizon is, so I guess they can't say no. But I wish they could. I don't like part of the private sector helping Obama and the feds destroy another part of the private sector. And apart from everything else we've talked about today in the past few weeks, just keep this in mind when people say, look at all the great things the government invents. The fact of the matter is the government invents nothing without private sector help. First of all, private sector money, taxes. Secondly, private sector know-how. Well, Mark, what about the NIH? It's still private sector know-how and private sector money working with the NIH. But look at this. So the private sector is good enough to be called in to fix this. And yet, it's this, the federal Leviathan, that's supposedly good enough to run something far more complex than a website, and that's our complex, intricate healthcare system. Isn't that crazy? So I'm sure Verizon had no say in it, but I'm a Verizon customer, among others. I don't much appreciate this. The idea that the federal government has this expertise, isn't it a little bit ironic that they're having to call in experts from the private sector? Meanwhile, it's the private sector they seek to control. You and me. Here's Obama today. Now, listen to this, please, under the context that I've been talking about for the last half hour. From the Rose Garden today. Cut 2. Go.
Through the marketplaces, you can get health insurance.
All right, let's stop a second. Let's start that over. But there are no marketplaces. There are government-created markets, and they're not really markets, an exchange. And precious few insurance companies are participating in these state exchanges. So they like to talk in capitalist talk when they're actually conducting themselves in socialist behavior. Cut 2, go.
Through the marketplaces, you can get health insurance for what may be the equivalent of your cell phone bill or your cable bill.
Stop right there. Now, this is absurd. Obviously, it depends on the individual, but it's always depended on the individual. It wasn't that long ago that Blue Cross Blue Shield offered premiums at $200 or $300 a month, $350 a month. I don't know if they do today. I don't have Blue Cross Blue Shield. We have a group policy at my legal foundation, although the price of that's going through the roof. So that's not new. That's not special. But I do have a question. May I ask you a question? If somebody can afford a cell phone and cable TV, why the hell am I subsidizing their health care? What's that all about? The equivalent of your cell phone bill or your cable bill? If you can't afford health care and you expect somebody else to help subsidize you or pay for it, then drop your damn cell phone and your cable TV. The president makes this statement, and nobody even seizes on it. He doesn't even realize how remarkable this statement is. If people choose to purchase cell phone contracts or cable contracts, why are you and me, why are we subsidizing them? Go ahead, Mr. Producer.
And that's a good deal.
Not for us.
So the fact is, the product of the Affordable Care Act...
Stop. There is no product of the Affordable Care Act. Obama didn't create a product. The federal government didn't create a product. The federal government is imposing requirements on private insurance companies, and they are having to create these policies, many of which are causing them to have to charge the rest of us an enormous amount of money. If somebody says to you, shouldn't you cover pre-existing conditions? If you say yes, well, somebody has to pay for somebody who may be 47 years old, a chain smoker with heart disease, a heart attack. Now that guy wants insurance. You have to pick him up. He's going to be in the hospital a hell of a lot. Well, who do you think's going to pay for that? There's a complete disconnect between personal responsibility and who's funding this stuff. Go ahead, Mr. Producer.
People without health insurance is quality health insurance that's affordable.
Stop. How do we know it's quality health insurance? And in most cases, we know it's not affordable even with the subsidies. This isn't about quality medical care. He talks about quality health insurance. The president has also said in the past, and I've jumped on this, and you're well aware of this, that you have a right to health care, a right to health care. That is, if you can get through the website and call the 800 number, I guess. Otherwise, I guess you don't have a right to it. But that's preposterous. I don't even know what that means. What do you mean you have a right to health care? You have a right to any procedure you think you need, or any prescription you think you need? If you have a right to it, if you can't afford it, that somebody else has to pay for it? You have a right to what? You have a right to a hospital bed? You have a right to any demand you make in the hospital? You have a right to health care? And yet Medicare, which is the premier government health care program up to now, has the greatest percentage of rejections of any health care entity in the United States, including every single major insurance company. So there's Obama speaking in platitudes, like the utopians do, constantly focused on generalities, constantly wanting you to look ahead. Don't look behind. Don't blame me. I'm only trying to do good. Keep looking ahead. Keep looking at the big picture. Keep looking at the vision. Promise, paradise, just over the hill. There is no paradise over the hill. Go ahead, Mr. Producer.
And that product is working. It's really good. And it turns out there.
If that product's really good, do you and your wife and your children have that product that's really good? Of course not. And if that product's really good, Congress should pay for it, rather than you and I subsidizing it up to 75%. It's a good product, and you and I have to pay for it. But all that aside, let's say it's the greatest product anybody has ever devised. What if I don't want it? What if I want to pick a different product? Well, you're not allowed to. Well, if it's the greatest product, if it's a really, really good product, and it's fairly cheap, and it's quality health insurance, well, why doesn't everybody want it? Because he's a liar. That's why. I hate to put it in stark terms, but why shouldn't I? It's a really, really good product. It's really, really cheap. If that's true, then everybody would want it, and everybody doesn't want it. If that's true, then the majority of Americans in all these polls and surveys would say they love it, but they don't love it. And so what do they say? Wait, we haven't implemented it yet. Well, once they do, there's no turning back. Wait, you haven't implemented it yet? Really? Well, how many pinpricks is it going to take? How many turns of the screw is it going to take before we like it? And then when do we know that it's been fully implemented so we can make a decision if we don't like it? And if we don't like it, Mr. President, what then? We see you're prepared to shred the Constitution even further if you don't get your way. What then? There's nothing then. There is no recourse then. It's too late then. And that's what he's hoping. Continue, Mr. Producer. Go.
There's a massive demand for it. So far, the national website, healthcare.gov, has been visited nearly 20 million times.
All right, stop. That doesn't mean 20 million people. That means 20 million times. My website last month, actually August, in the heat of the summer, was visited, 2.4, 2.6 million times. A lot of people want it. The difference is I'm not forcing anybody to go to my website and listen to the program. He is forcing you, those of you who need to go to his website. And then you go, whoa, look at the great demand. There's 20 million people here. That's because people are losing their health care and they're desperate. They're looking for alternatives thanks to Obama. Thanks to Obama, they're desperate. Go ahead, Mr. Producer.
20 million times.
All right, enough of this one. Let us go to Cut 3, because Cut 3 will demonstrate what I said earlier from Chapter 1 of Ameritopia. Whatever's wrong with this can't possibly be the fault of the mastermind, Obama. And it can't possibly be the fault of the ideology. It can't possibly be the fault of the model. Before they were talking about glitches, but now that's becoming almost comical. So now he has to act like he's the outsider. And he's going to demand that this get fixed. Cut 3, go.
Nobody's madder than me about the fact that the website
All right, stop. Let's go back to the beginning. Nobody's madder than me It's nobody's madder than I. I don't mean to be a stickler, but you are president. And you're reading off a teleprompter. Can't the person who types it in get it right? Go ahead.
Nobody's madder than me about the fact that the website isn't working as well as it should, which means it's going to get fixed.
Oh.
And in the meantime, you can bypass the website and apply by phone or in person. So don't let problems...
Stop. So people went to the phone, they called the 800 number, and they told them, sorry, the system's down, it'll be down for 2 days. Go to the website, which is impossible to get through for most people. You thought you were having a problem with your insurance company, those of you who are complaining? This is just beginning. Who are you going to call when you need a procedure? When your doctor concludes you need a procedure and the system is down, or somebody's on vacation, or you can't reach the proper office? Who are you going to call then? Who do you appeal to then? That's the point. They've got you, don't they? Yes, they've got you. Go ahead, Mr. Producer.
Would the website deter you from signing up or signing your family up or showing your friends how
that's
to
enough. Can you imagine if the insurance companies in this country, prior to all this, had said, you have to sign up for your insurance through this central website, and it didn't work? And they said, look, you have to expect these glitches. It's just because people want health care. Well, you're an insurance company. Of course they want health care. Well, what do you expect? We'll fix it. Nobody's madder than me, a.k.a. I, so we'll fix it. What's the problem? You're going to have cheaper health care. You're going to have this. Do you think any insurance company in America would have gotten away with this? No, they wouldn't have gotten away with this. But the government gets away with it all because it's not responsive to the consumer and you have no recourse whatsoever. There is no competition. I keep hearing it said, ladies and gentlemen, that Obamacare will fall of its own weight because sick people are signing up, but young, healthy people are not, and they need 7 million young, healthy people to sign up. Obamacare can't work without them. I'm thinking to myself, what the hell are they talking about? What do you think will happen, Mr. Producer, if sick people sign up, young, healthy people don't sign up? Who do you think's going to make up the difference? Well, yeah, us, the taxpayer. I mean, is this a joke? Oh, no, you don't understand. The actuaries don't matter. Mathematics doesn't matter. Arithmetic doesn't matter. What do you think's going to happen if sick people sign up and young, healthy people don't sign up? Well, it can't work without it. As if these other entitlement programs work as they're supposed to work. What do you think we have? We have over $90 trillion in unfunded liabilities. And by the way, you hear that figure announced out there. That's because it's in the Liberty Amendments, and I did the calculations. So that's what it is. Could be more, but it's at least $90 trillion. Well, it's not. It's going to implode. And how's it going to implode? Well, it's not going to work. Well, what does work that the federal government's involved in, particularly at the domestic level? Food stamps working? That's a slush fund. One GAO report puts government waste at about $200 billion a year. Who's going to make that up? Well, we do. They either borrow money or they raise our taxes. So now we're supposed to believe that, unlike all the other entitlement programs, unlike all the other operations of the federal government, that if enough money doesn't pour into Obamacare, somehow it's going to destroy itself. Well, let me tell you a little secret. We already know that's the case. The Congressional Budget Office, which is weak enough, has already said this program's going to cost over $1 trillion more than originally estimated. Where do you think that's going to come from? You and me. So some of these Republicans, they just don't want to take this on. They'll complain about it. They'll analyze it. They'll attack Obama. They'll talk about the thing imploding. What they will not do is take steps to take it down. That they won't do.